Hi, I'm Jennifer Wild, and you're listening to Sober Exposure. If it's about recovery, we're gonna cover it. It's like one big therapy session, but it's free. So thanks for joining our dysfunctional family as we uncover recovery with Sober Exposure. Let's go. Welcome to Sober Exposure. I'm Jennifer Wild. And this, I have to say, I mean, every episode is like my baby. And every time I'm like, oh, this is the most important episode. This episode is so friggin' important because it's about depression. And because I also suffer from a little bit of narcissism and histrionic behavior and everything's about me, I've been struggling with depression since age 5. And I haven't been able to find a solution. Medication, obviously drug addiction. And this is a show about addiction. And they pretty much go hand in hand. And I always ask myself, what came first, the chicken or the egg? Like, was my addiction self-medicating my depression? And I'm not sure that anybody could really answer that. If I didn't have depression, would I be an addict? I don't know. So a lot of the followers of Sober Exposure have seen me with this machine on my head and getting these little zaps. And I've been recording it and I've been kind of going through the process with everybody. And it's something called TMS. And it's really been a life changer for me. It really has been a life changer for me. I've been looking for the answer in drugs and alcohol, in shopping, in men, in sex, you name it, food. And I got to say that I can get out of bed now. I'm almost done with the cycle. And I want you guys to talk a little bit more about what it is and everything. But I want to introduce, I've got John, the founder of Success TMS. And I have Dr. Israel, who is the medical director of Success TMS, correct? Okay. Cool.
Yeah, almost correct. Dr. Israel is the chief medical officer of our company.
Okay. So she's even bigger than that. All right. Chief medical officer. So basically she's the smart one. We're the dumb ones. All right. Got it.
not even close, but it's a technicality.
So, all right. So I want to start with you, John. Okay. Now you obviously, there was a reason why you wanted to get something like this started. And we're going to go into what TMS is and everything, but I want to talk a little bit about depression because there's so many people out there that struggle with depression and there's still a stigma. I don't care what anybody says. It's still stigmatized. Like you can't call in sick for a depression day. Like you can't, You can call in sick for the flu, but I can't call in sick because I'm having a friggin' bad depression day where I just want to kill myself, literally, there's still stigma attached to mental health. So John, tell us a little bit about your story.
Well, first of all, Jen, thank you very much for having us on the show. And, we're very happy to be here and spreading a little bit of awareness, not just on what we do on TMS, but for the whole mental health world, right? Because I think you said it perfectly. Whether, I know the audience here is an addiction focused audience, but it's all intertwined. It's all interdependent and they overlap quite a bit. And I think Dr. Israel will be able to speak more to that. So let me give you guys a little bit of the story that brought me to TMS. My sister, who was 31 years old, in 2017, was struggling with depression. And I was trying to help her find the solution. And as I was going through the process, I realized nobody can direct me in any place. I didn't have anywhere to go as far as resources. There's nowhere to go online. There was nowhere to go in the city. There was just nowhere to go. So we went to the hospital and we were given a bunch of different suggestions, a bunch of different programs. And one of those programs was obviously a medication-based program, which didn't really work out for her. And unfortunately, even though we tried a ton of different stuff, I mean, everything under the sun. In July of 2017, Alex committed suicide due to her depression, gave up. And from that moment on, literally on that day when I got home after a day that I'll just never forget with my family and all that stuff, I said to myself, there's got to be a better solution to this thing. I mean, how did this happen? So I went into this obsession to try to find a solution. The toxicology report came back, and because, you know, we were afraid that maybe she was doing drugs or alcohol or anything like that. And in fact, it was the complete opposite. There was nothing in her system, not even a trace of the medication.
She wasn't taking her meds.
Correct. So then I started saying to myself, okay, obviously something's broken here. There's a reason for why medication isn't that successful for many people. And I said, and this happens in all kinds of different areas. And I said, you know, we're asking a person who has a difficulty with themselves and their place in the world to manage their health, their mental health, which is something that's hard to do even for a professional, let alone an individual, a patient, because you're biased, you're not looking at yourself the way that everybody else sees you, usually much better than you see yourself. And what I realized is, Alex, we couldn't track her success. Right. So all of a sudden, I said to myself, A, we need to find something that works. B, we need to find something that holds everybody accountable, that we can track. You know, for example, TMS, if you don't show up to our clinic, we know you're not showing up to your clinic, but we know you're not taking a phone call
if I'm 2 minutes late.
Yes.
Where are you?
And that's Dr. Israel's team, who will make sure if you don't show up that, you know, it's your health. Yeah. So, you know, those are the types of things that are important that I wish we had for Alex. And I was fortunate enough in 2017 going through this, I discovered that TMS was out there, and that insurance companies were starting to cover it. And so at that point, you know, I put a little group of people together and we said, you know, we have a big problem in the world and we can change people's lives. I'm an Elon Musk fan. You know what, when I read what he says and his investment strategy, he says, I only invest in things that change people's lives. Mm-hmm. Well, we had this opportunity. And then by absolute luck, I landed on Dr. Israel, Dr. Lindsay Israel. In fact, the joke is that her husband had applied, had at the time said, hey, maybe I'm interested. And then he said, you know what? I think my wife, who's also a psychiatrist, would be a perfect fit. And he was right. And what makes Dr. Israel so unique, and why I'm so happy that she's not only on this call, but she is my partner and a very close friend, she's able to bring compassion, empathy, and medicine together, which is something that I had not seen before in the mental health world. So, you know, I hope I didn't go too long here, but that's my story of how we got
perfect. Perfect.
And how we met Dr. Israel, and how we started the company with one small chair, and now we're the second largest in the world.
Yeah, you have many different locations. So let's just dumb it down here. So TMS, what does TMS mean? What does it stand for, Dr. Lindsay? What is TMS?
TMS stands for transcranial magnetic stimulation. So we're using magnetic pulses, kind of similar to what an MRI system creates to produce images. This isn't producing an image. This is creating an electromagnetic field. And we can target a specific area of the brain with those pulses and create an electromagnetic field within that very specific localized area. And what we found is that over time, with repeated pulses, that's why it's technically called repetitive RTMS, repetitive transcranial magnetic stimulation. Over time with repeated pulses, because again, the brain likes repetition. That's how it learns. It picks up on those patterns. It learns the signaling. So with repeated pulses, you can actually create electrochemical changes within the brain that can last. And that's also, I think, the other key is it's great to feel good in the moment. And along the lines of what you were, speaking on your personal journey with recovery.
Right.
It's
Drugs, they make you feel great.
Right.
The drugs make you feel amazing. The problem is it's when you're coming down.
It's not about just feeling good in the moment. And to me, an ideal treatment is something that there's ideally a beginning, middle, and an end to. So TMS, as you mentioned, it's a course, a cycle. It's a course of treatments, 36 treatments for depression. And then the benefits, the ground that you've gained should hold. That to me is an ideal treatment. With medication, what I think most of us have found is that typically that needs to be ongoing. Usually the recommendation is at least 1 year you're on medication. If you find the medication or typically a combination of medication that works for you, you don't make any changes, no matter how good you're feeling, 1 year minimum. And then you can reasonably try and wean away and taper off and see, can you maintain? And I think what we found is it doesn't always work out that way with medication.
Right. It sounds like the difference is because this changes the chemistry in the brain. I mean, it almost seems like the meds are more like a Band-Aid almost. And then what I noticed too is that if I'm on a certain medication, it stops working after a while for me. Like
the poop out. Yeah.
It just stops working. And then I have to take a higher dose. And then I'm more doped out and zoned out because a lot of those meds make you tired or fat or side effects. And this doesn't have the side effects. So another question, back in like the 70s, and everybody's, it was very effective, but it just seems scary. Like you'd see like movies, like One Flew Over the Cuckoo's Nest, where with the shock therapy.
Yeah, ECT.
So,
yes.
Yeah. So what's the difference between TMS and ECT?
It's actually pretty significant of a difference. And I know it's very easy to confuse the two because they're both like 3 letters of an abbreviation.
Yeah.
But ECT is actually utilizing an electricity. So you're actually using electricity to induce a seizure. So it's not so much about the electricity that the treatment, where the benefits come from. It's basically you're inducing a seizure, a controlled seizure in a way. So it's done under anesthesia. It's only done in a hospital.
Oh.
You can do it outpatient, but it's only done in a hospital setting. So it's typically in an OR or some kind of recovery room. But you technically can leave, but you can't drive, during your treatment course. But you're basically inducing a seizure, and it's the brain's reaction to calm the seizure down where you can get the clinical benefits for depression. Let's, for example, or other conditions too, but we'll talk depression. So you're inducing a seizure, and the brain's reaction to that seizure to calm it down is where you get benefits. But again, because it's a seizure, it's in a hospital, you're under anesthesia, you're not able to drive, it affects your memory, is one of the most common side effects of ECT. You lose your independence because you're not able to drive. I mean, I've heard of patients where they've had to relearn where things are in their kitchen, what's in their drawers. I've had, not that I don't do ECT, but I've had patients that have had it in the past. I had one patient, she was a teacher, and she said she had to relearn all of her students' names. She couldn't remember their names.
I really, really like my tongue. It does a lot of great things. And when I think of a seizure, I think of biting your tongue off. Yeah. So no.
Oh, I know. It's a controlled seizure. So basically during the ECT treatment, you're actually paralyzed. They give you a paralytic, and they just put a tourniquet typically around the ankle. So really all you see is a foot twitch. It's not like a full flailing, clonic seizure. So it's not that dramatic looking like in the movies, but back in, to ECT, I won't say ECT, but this type of seizure induced therapy, they used to overdose you with insulin to induce the seizure before they started using electricity to induce the seizure. So obviously it wasn't as controlled, but it's definitely not like One Flew Over the Cuckoo's Nest anymore. It's not like that, but it's a more invasive treatment. And it really has, I think, more lasting benefits. They'll tell you side effects. They'll tell you, the memory issue is only, that day of your treatment. You might be a little foggy. I don't think that's entirely true. I think it does have more impact on memory.
Well, even when you take anesthesia in the elderly, that could hinder memory. That could accelerate memory loss and all that. So just the anesthesia alone. So yeah, I'm team TMS, definitely.
Yeah. Yeah. So, I mean, it's really, if you're a candidate, theoretically, if you're a candidate for ECT, you should be a candidate for TMS potentially. I mean, you should definitely be evaluated for trying something like TMS first, which is, non-invasive. You don't lose your independence. You can drive yourself to and from treatment.
And the treatments are only like 20 minutes. And if I wanted to get evaluated, where would I go? I'm depressed. I don't feel good. I can't get sober. And I know it's because I'm depressed. And I don't know. Do I go to a psychiatrist? Do I go to a therapist? What do I do? How do I find you? Where do I do? What do I do? I'm interested. Tell me.
I'll tell you, and I think John can probably attest to this. Most patients, I think, find us by searching non-medication treatment for depression or non-invasive treatment for depression. You really should see TMS pop up, and I'm not in the techie savvy world, so I'll speak very crudely.
Just Google Success TMS.
Basically,
Could they get evaluated through you guys, or do they have to go and get outside help first?
No, we have providers. We have psychiatric specialists, psychiatric providers that are TMS certified. And they are also psychiatric providers. They can do the evaluation as well. But even before that, you'll meet with a TMS coordinator first for a free consultation to begin the process. And we can gather a lot of the clinical data at that point, and there also help determine, what the next best step would be for you in terms of TMS. Are you a candidate? And that person, the TMS coordinator, can help navigate as far as your insurance coverage and give you all those kinds of options. So even before you see the provider, you can come in for a free consultation first, just to even hear about it. You don't even have to commit to anything necessarily.
Right. And that's what happened with me a couple of years ago. I actually went into your office, and it was before my insurance didn't cover it. And then I was like, I don't want to commit. I don't know. I just gave up. I went for the consultation, and then just because the good ADD, non-follow through that I am, I was like, whatever. And then a couple of years later, when it got really bad, I came back to you guys. And what I noticed also, it's not like we said, especially for addicts, quick fixes are not good for us. They're not. It's not good for an addict to have a quick fix. And it was like, I think it was just like, seriously, a couple weeks ago that I noticed it's not like one day you just wake up and you're not depressed. It's not like that.
No.
And if it were ain't nothing for free. I always say, like, if it were that, it wouldn't be real. It was just like a gradual thing. And then all of a sudden I was like, wait, hold on a minute. I haven't taken a nap in like 3 weeks.
Yeah. It's a eureka moment. It's a eureka moment, but you realize it's been an ongoing process.
Right. It's like, right. I my thing is my naps or not wanting to leave the house. It's like, wait, I'm getting all of my errands done. What the hell is that? Even the fact that I'm showing up every day, because it's 5 days a week, and then you take the weekends off, and it's only like 20 minutes, and the staff's amazing. So a couple other questions. Well, so it treats depression. What about the anxiety aspect of it? Craving, stuff like that. Do we have a side of the brain we can treat for that?
The answer is yes. So TMS has actually been investigated, studied for various conditions. It's FDA approved technically for major depression, severe depressive disorder. And there's also indications with deep TMS for treating obsessive compulsive disorder in addition to major depression as well.
Wait, with what? With deep TMS?
Deep TMS.
What does
yes.
that mean?
So deep TMS is it's a sort of a subtype of RTMS. It's a different system, a different manufacturer, but it's a pulse that basically goes deeper into the cortex. But what we know to be true when it comes to a magnetic beam, the deeper you go, the wider the pulse spreads, basically. So it's not as focused as RTMS is as far as hitting a specific target. But that particular system, the deep TMS system, is technically what has the FDA indication for OCD. But my point is that those are the two conditions that are FDA approved. And there are more indications that they're looking to obtain from the FDA. Recently, a study came out that showed patients who are getting depression treatment, and we know depression and anxiety, we call it comorbid, they're highly paired together.
Yeah. Damn it.
The study showed that patients with depression getting treatment for depression also see an improvement in their anxiety symptoms when you evaluate those symptoms sort of separately with a different rating scale. So when you come in for your depression treatment every Friday, I'm sure you were getting your PHQ-9 scores done, and how we kind of monitor the progress. And at the end of your treatment, it's kind of like your diploma. You'll see visually how we want those numbers to come down. The lower the score, the less symptoms you're having. So we can track that also. There are rating scales for anxiety as well. So a study showed and proved what we really theorized for many years, is that if you can treat your depression symptoms, anxiety symptoms also can secondarily improve. On top of that, there are other protocols, like you said, targeting a different area of the brain. Theoretically, you could also more specifically target anxiety symptoms, but those protocols are considered off-label because they're not FDA approved. So those particular protocols are not covered by insurance. But there are protocols. You mentioned cravings. There are protocols for fibromyalgia or neuropathic pain.
Wow, that's going to be important. That's going to help a lot of people.
Tinnitus, for the ear ringing, tinnitus. There are protocols for that as well. Again, all off-label.
How about shopping addiction? How about wanting to buy too many Gucci bags? How about
that? I'll need that too. But or at least wanting one.
Right. Yeah, exactly. Yeah.
Yeah. So yes, there are there's
so we got to get to the FDA, because we got to get to the FDA and have the FDA approve all of this, because this is what pisses me off. It's like, okay, so I could get my Prozac, I could get my Depakote that's gonna make me a zombie walking around all day like a friggin' zombie. I hate that shit.
Yeah.
But something that's totally safe and natural, and
I agree.
It's not approved.
Exactly. I actually wrote an advocacy letter when the pandemic first hit. What we found is that our patients, even the current patients and even new ones, were still reaching out for a treatment that does require you to physically come in for treatment. It's not something you can do through telemedicine. And patients were so happy with their results. They didn't want to lose that and backslide, especially if they were in the middle of their treatment course.
I can't imagine. I didn't even think of that.
So I wrote actually an advocacy letter specifically asking, humbly, my little, self, my one doc self, asking the FDA to consider sort of fast tracking and approval for anxiety disorders, because the pandemic was triggering so much anxiety for so many people. I'm still waiting for a reply.
You're still waiting for a response.
I tried.
we all have to advocate. And I have off the chain debilitating, for me, my mental illness as well. I've been diagnosed with every single one of them, and I don't buy it all, but I definitely have debilitating depression, and anxiety, which you said go hand in hand.
Yeah.
And my ADHD it's like, it is. I hate to use the word again, but it's debilitating. And It's a big reason why I use drugs. That's why I like cocaine, because Cocaine
It's a
is,
stimulant.
yeah, it's a stimulant. It slows me down. And like most people are like, me when
No,
I'm on
it's
cocaine.
not. Yeah, stimulant is like a misnomer term. It doesn't, a stimulant for someone with ADHD, it calms them, allows them to kind of focus on one thing. Again, when it's cocaine, it's sort of just in the moment. It doesn't have the lasting benefits. But yeah, stimulant's misnomer. You're not stimulating the person. You're stimulating that specific area of the brain, the prefrontal cortex, which is in charge of controlling executive functioning and attention, your ability to inhibit yourself, basically.
So it's interesting. So there's all different types of TMS. Is not just for depression. This machine or whatever can treat a lot of other mental disorders, I guess, but not FDA approved yet.
Correct.
Okay.
Correct.
So that sucks. How long is this?
It's a work in progress. Hopefully, I would love to see. It's on its way. Yeah, it's being actively worked on, even for pediatric depression, adolescent depression. They were working on getting FDA approval because this is not, depression, as you mentioned, you were 5 years old when you really develop depressive episodes. I'm a child and adolescent psychiatrist as well by training, so I've seen it firsthand. Depression is not just an adult condition. It's not just an adult disease. It affects children, and most of the time it starts in childhood.
Yes. And let me ask you this question. Is it true? And this is for personal reasons too, because I have a son. I have mental illness. My family, I come from I'm so proud. I come from a long strain of mental illness. It's awesome.
Get it honest.
Yeah. And I mean, I'm convinced, just because I've seen it and I've been around it, that my son is bipolar, but they won't diagnose him with bipolar because he's only 16. And they say they won't do that until they're like 18 or 19, till they're older. He's showing every symptom. I mean, he definitely has ADHD, but the bipolar is like,
and there's so much overlap with the two.
Yeah, I suppose.
And you could have both. You could theoretically, meet criteria for both, but there's a lot of overlap in symptoms. I mean, you can technically diagnose.
So you can, okay.
Oh yeah, absolutely. Absolutely. It's one of those diagnoses. It is a lifelong diagnosis. It doesn't just disappear or go away. You don't outgrow something like that necessarily. So I think more they want to continue to sort of evaluate, would be my guess, but you technically can. I mean, once it's apparent, because you want to at least try and diagnose. As early intervention is always the key with most psychiatric conditions, especially with, depression or mood disorders in general. The earlier you intervene and treat, so if you can get an accurate diagnosis, then ideally you're getting an accurate treatment protocol started. And actually, when it comes to bipolar depression, we know that, again, it's off-label technically for diagnosis of bipolar disorder, but the depressed phase of bipolar disorder, so bipolar depression, responds beautifully to TMS. Wow. Beautifully.
That's amazing that there's something out there. I have a brother that, I mean, I just can't even, we're not even going to get into him, but his bipolar disorder is, and it's explosive bipolar disorder, which makes it even worse. Yeah. And is it true? Like with him, he always had something. There was always something, but I had heard that a lot of times with bipolar, it could actually accelerate later in life when you're in your 30s and 40s. Like maybe you could have a tendency to depression, or is that correct? Is that true?
Yeah, so you'll see what typically happens is sort of like a natural course of bipolar disorder is that you might have more manic episodes in the younger years, like 20s, 30s, 40s. And then as you get older, a lot of times the manic episodes or hypomanic episodes aren't as frequent, but you'll definitely have more of the depressive episodes, especially, kind of later on in age. But everyone, it's like snowflakes too. Everyone's bipolar disorder is different too. Some patients, and here's the kind of crux. It only takes one manic episode to be diagnosed with bipolar disorder. You could have 30 depressive episodes. So there are people out there that have had depressive episodes most of their life and haven't really had their first manic episode yet, but it just hasn't come out yet. So until you've had your first manic episode, you're not even considered bipolar because you don't have that history. As soon as you have one manic episode, your diagnosis changes from depression to bipolar disorder because the treatment is different.
Now, yes. And
As
explain
far as
what a
medications
manic,
go.
yes. Yeah. Explain what a manic episode is. If someone's like, I don't know if I have, something's weird. What would define a manic episode?
So a manic episode would be symptoms consistent with being, we would say, more grandiose, or a change in behavior or your thought patterns where you have this burst of energy, you're go, you're talking fast, your thoughts are coming fast, people around you are saying, like, what's going on? Slow down. You would do theoretically more impulsive things, more risky behavior, such as like hypersexuality, promiscuity, spending sprees. Some people become hyper religious where, you know, when they're not in a manic episode, they really, you know, they're not really religious. And then all of a sudden they're talking about, you know, religious idols or things like that, God, whatever. One of the key symptoms with manic or hypomanic episodes is a decreased need for sleep. Not just where you can't sleep, but you feel tired, where you don't even need to sleep. So you're up all night, you might be rearranging your furniture, you could be calling people impulsively in the middle of the night, you might be making lists, all of a sudden feeling like you can write a book. You know, those are all just some examples of symptoms.
It sounds like either me on crystal meth or,
right.
No, I'm just kidding.
But that's the confounding thing, is that if it's induced by something like steroids, like just a treatment that we use in medicine, corticosteroids used for, you know, like prednisone, if you're having some kind of inflammatory response in your chest or something, or asthma, even steroids like that can induce a manic episode. So typically bipolar disorder is where those are eliminated from the equation. It's not triggered by something else.
Okay. So if you feel like you or someone that you love is struggling with that, obviously you can go find somebody to talk to and get some help with that, because that can be really scary. I've seen bipolar all around me, and it's terrifying.
Oh,
absolutely. You know, it's terrifying. And mental health is like, man, I feel like we've come a long way, but I don't feel like we've come long enough. You know, we haven't come far enough.
We're not there yet.
No, I mean,
just
kind of far. Yeah.
We're just scratching the surface.
Yeah.
So, TMS has been around. How long has it been around?
So it's actually been really investigated since easily the mid 90s. I mean, the concept of using, you know, magnetic resonance technology has been around a long time. As far as it really kind of developing and becoming more and more mainstream, it really didn't occur. So TMS was FDA approved in 2008.
Okay.
So it's been FDA approved for, you know, well over a decade at this point, but it didn't start to become covered by insurance plans or Medicare until like 2013, around then. So even from the time it was FDA approved, it really didn't gain any momentum, or, you know, not notoriety, but it really wasn't on the tip of anyone's tongue, even psychiatrist's tongue, because it was out of pocket. It wasn't covered by insurance, and people didn't really even know about it as an option, as a treatment option. Yeah. Until, you know, later into the, you know, 2010s.
Yeah. And they still don't know enough, because I said, when I do my Instagrams, I get so many messages, because I say that I'm at TMS for my depression, and everyone's like, what is that? I'm depressed. That's why I had to do this podcast. It's like, you know, we need to spread the word that there's a solution out there, because I've been a lost, depressed soul since age 5. Like I said at the beginning, like you said, and I say that because it's true. I literally was in kindergarten and I was like, there's something wrong with me. Everybody else, all these other kids are in the jungle gym and they're happy. And I knew that I had a loving family. I knew all that.
Right. Depression doesn't care. Depression doesn't care that you have a loving family, that you've got, you know, financial stability, that you got. I mean, depression does not care.
It doesn't discriminate, right? Just like addiction, I say. So that's why I wanted to get this out there, that there is an option, and I can speak personally for it, that it has helped me immensely, you know. It's helped me immensely. Am I perfect? You know, no. And like I said, if it was a complete quick fix, then it wouldn't be real. Like, there's no such thing.
Right.
But I'm going to tell you that my debilitating depression to the point where I could not get out of bed
Yeah, the functioning
is
part.
non-existent. Yeah, it's non-existent. You
Right.
know, am I still a bitch sometimes? Hell yeah. You know?
But we don't want to change who, you know, the
Yeah,
goal is
right.
not to change
Yeah,
someone.
you're not changing your personality.
Yeah, that's not it. So depression is not a weakness or a flaw. And I think that's also why there's that stigma still out there that people don't want to share it because they feel like it's a weakness or a flaw on their part, or somehow they were raised to think that it's a weakness or a flaw, and you just have to sort of pick yourself up by your bootstraps and just get out of bed. But it doesn't work that way. It's symptoms that don't belong to you. It's not who you are. It's a group of symptoms, a condition that doesn't belong to you. And you mentioned options. There are options. That's the whole point. I'm always one to advocate for giving people options. And it's not only one thing that gets us into a state of depression often. So it's not always any one thing that gets us out, but I like having TMS as an option for people out there. And it's a great option that has been time tested, proven safe, proven effective. And you're not stuck with either medications or ECT as your only options.
Right. Or
let's give you an analogy for you know, the layman's like myself and perhaps some of the folks listening. You know, when we talk about depression, that depression doesn't discriminate, that, you know, Dr. Israel said that those symptoms don't belong to you necessarily. This is no different than physical fitness or being predisposed to gaining weight more than another person. It's the exact same thing. So some people don't have this depression issue. They're just not vulnerable to it.
Couldn't you just kill those people?
Yeah, well, but don't we say the same thing about the most beautiful person we ever saw, or the tallest person we ever saw, or the skinniest person we ever saw, or whatever it is? We always say that about somebody else who has some lot in life that is positive or that we view as positive, and yet we don't have that. So we say that. And by the way, I have yet to find a person on the planet, and I've spoken to quite a few, that doesn't have a problem somewhere, somehow. And if you're suffering from depression, that could be your problem. But it's the same as fitness. In order to stay skinny, if that's what you want to do, I'm just throwing it out there, you got to eat well. And we probably have to use the word fit because I don't think skinny is the right word. But if you want to stay fit, you probably have to eat
politically
well.
correct here. Okay. Nothing's politically correct.
But, right. So it's the same thing with depression. What I think a lot of people don't realize is you have to stay fit with your mental health. I still find it absolutely astonishing how much money people will spend on a physical trainer and yet won't spend the same amount of money or any money on using a therapist or a coach. Life and your brain and your life is dictated by your values, your actions, and your brain. So why aren't you protecting those things as much as you would anything else? Like, that's the question, right? So once we look at it that way, we don't have to sensationalize or catastrophize depression. We can then say, okay, maybe there is a rational approach to it. We just need to find the right tools, of which TMS is one of them.
Right.
TMS is just a technological advancement on medication. That's all. It's like using this cell phone as opposed to the old brick cell phone from the 1980s. It's just evolution. That's it.
Yeah.
And once people are open to it and understand it, we're going to be able to raise that awareness. Here's the great news. Insurance companies dictate that in many ways. You're going to see a lot of studies now, and you're going to actually see a trend for TMS where when we started it, when Dr. Israel and I started in TMS, you needed to fail 4 medications in order to qualify.
Yeah.
And Dr. Israel, today, in most states, insurance companies ask for how many failures?
Could be 1 to 2 at this point.
So what does that tell you?
It's moving in the right direction.
Yeah. That means the insurance companies are seeing evidence that it's working. Plus, they're seeing evidence that over the long term, so over the life of the patient, that the cost of care is less.
Yeah.
And that's why TMS is advancing. And as we continue to spread that word, it will continue to advance. And Dr. Israel and I believe that TMS might become the next platform method of treatment, the next medication.
It should be a first line option. It should be an option for anybody. You shouldn't have to fail and go through that process. Because Jennifer, I'm sure you can attest to what that feels like. You know, every time you try a new medication, you're doing this and waiting, what side effects am I going to have?
Yeah.
And then when am I going to feel better? It'd be nice to have TMS as an option for people first line. If they choose not to go down the medication road, or they still could choose that, but at least they don't have to. They're not forced to try that first necessarily. That would be, kind of my on my wish list for
it doesn't make sense. Yeah, it doesn't make sense. It's okay for you to take a synthetic, medication that can give you even more anxiety, could make you tired, can make you not want to wake up, can make you lose your hair, can make you gain weight, but it's not okay to, just get your brain tapped, it doesn't make sense at all. But I mean, that's the world today. So yeah, like you said, all we can do is what we can do is just raise awareness, yell out loud, write letters like you did,
advocate as much as you can.
Very much so. And a firm believer of that. So, I actually have my TMS appointment coming up here pretty soon. So I'm going to have to skate. Now I have one more question. So let's say you're out, you go 5 days a week, 5 on, 2 off for like 40 something days or 38 days, whatever, how many ever days it was. So like last week I went away for Thanksgiving and I was like freaking out because I was like, oh my God, I'm going to miss like 5 days.
That's normal to worry about that. That's normal.
Yeah.
But it's not, it's perfectly fine. We've had patients that, go on a vacation, or patients that become ill, have the flu and they can't come in for a few days. It's perfectly fine. Especially if you've had multiple treatments already under your belt, you don't just backslide.
It doesn't just go away.
It doesn't just go away. And that's, I think, the beauty in terms of TMS, as far as the durability of it. We have patients that are also, when they actually have completed their course, they, the worry is, I'm done, now what? Yeah. And they're very pleasantly surprised to see, they just take it one day at a time, and they see, even as we follow them up, they're holding true.
Great. Cool. All right. So it's Success TMS. The website's successtms.com. Simple as that. Yep. Correct. Mm-hmm. And you got it. Yeah, you guys can reach out to me if you want more information. We'll get you in touch with Dr. Lindsay, John, and everybody. They have locations all over the place. And if you're living somewhere where there's not a location, I'm sure you guys we'll
help.
Call us. Yes, please call us, because for Dr. Israel and I, this is a mission. And we will always place people and give people recommendations of where they could look and what they can do. Because again, this is about changing people's lives. Bring it back to what we said at the beginning. This is about changing the course of how we treat people in life. And the more people who know about it, like you, Jen, the more other people will know about it. So we wanted to thank you, obviously, for inviting us on and letting us share our stories, so that we can continue to create this mushroom of awareness and of information out there. There are so many tools, folks. There's one message we can give you. There are so many tools out there. So don't be afraid to call us. We can sort of walk you through it and give you some options up until a consult. I mean, even if it's not to work with us or to come see us, we don't care. We'll help you with whatever we can help you with.
We want to kick depression and mental health issues in the ass. I want to kick its ass. I want it to be my bitch, man. I'm not going to let it kill me.
Yeah.
John, I'm not going to be your sister. I won't allow it. And it almost was a million times, I can't.
And I'm so happy you're not. And that's why we're doing this. Literally, she wrote it in that letter, in the letter she left for me. She said, listen, take care of mom and dad. And the other thing is, if you can find a way to get rid of depression, figure it out, because I don't know anybody else who can. So that became my mantra to do this. Yeah. So I'm so proud that you are not my sister. And I'm so proud that we have thousands of patients who didn't end up like my sister.
Yeah.
And every day I open, I go online and you hear about these suicide stories. You hear about stories in suicide, even in younger age groups. Our work is not done. But God knows, and I know that Dr. Israel and her team has saved a ton of lives. And that's what I'm most proud of. And Jen, you're helping us do that.
Yes.
Your audience is helping us do that. Let's mushroom this story. Let's mushroom this story.
Awesome. Unbelievable. We're going to kick depression in the ass. That's the quote.
Yeah.
I like it. I like it.
All right. Sober Exposure, Jennifer Wild. You guys have a great week. Need more? Of course you do. The show's all about needing more. Go to my website at soberexposure.show or get stuck on my Instagram at soberexposure_podcast.